Le podemos llamar por si tenemos alguna pregunta al vídeo que nos ha hecho. Pero brevemente os voy a explicar un poco el programa. En la sesión que teníamos reservado a John Sharp hemos traído a Larry Chu de la Universidad de Stanford. Él es anestesiólogo y un apasionado de las nuevas tecnologías, con mucha experiencia en todo lo que sería social media. Acto seguido tenemos una sesión donde vamos a explicar cómo estas tecnologías pueden servir para educar a los profesionales, donde tenemos Macrina de la Fundación Recover, donde usan esta tecnología para formar profesionales en África. Tenemos también a Héctor Guitarte, un estudiante de Pamplona. Y en definitivas cuentas, para no distraerme mucho, tenemos un elenco de ponentes de todo tipo. Tenemos pacientes, gente de farmacias rurales, especialistas de enfermería, periodistas, investigadores, informáticos, y a lo largo de la jornada tenemos distintas sesiones donde se van a abordar diversos aspectos. Para no hacer John Sharp que se nos quede dormido a las 3 de la mañana en Cleveland, vamos a empezar con su vídeo directamente y acto seguido lo llamamos. Un segundo. Se me ha olvidado darle el audio.
A little bit about Hello, this is John Sharp, and today I'm speaking on social media and healthcare, a reasoned approach. Hello, this is John Sharp, and today I'm speaking on social media and healthcare, a reasoned approach. A little bit about me: I'm manager of research informatics at the Cleveland Clinic, basically a information technology expert in the area of clinical research. A little bit about the Cleveland Clinic. Our main campus is a 1,300-bed hospital, but we have regional hospitals in the northern Ohio area, 2 million patient visits, and at our core, really, a group practice of 2,700 salaried physicians and scientists. And known for our innovation as well as our Office of Patient Experience, and various locations around the United States, also in Toronto and in Abu Dhabi. There are opportunities to collaborate with us, and I'd be glad to talk with any of you. You can see my contact information at the end of the slideshow. So the question for today is: social media in healthcare helpful or harmful? My approach is, with proper controls in place, social media can have many benefits in healthcare for hospitals and other healthcare organizations. I really believe that social media is changing the conversation in medicine today, and part of the revolutionary change going on in medicine. So why do hospitals fear and block social media? There's several reasons. There are concerns about revealing confidential patient information, posting unauthorized photos or videos, looking unprofessional, making negative comments about patients or the hospital, giving unauthorized medical advice, negative comments by patients about the hospital, or employees just wasting time and being distracted from giving care. But the advantages outweigh the risk, in my view. There's ease of use, a low barrier to entry, improved communication, patient engagement, and at the bottom line is what's called participatory healthcare. So how to proceed? There was a case study done last year on our stepladder approach to social media success, and I'll talk a little bit about that. Back in the early days of social media, there were several individual bloggers, including myself, but no policy and little awareness in the leadership about how to use social media and its impact. But starting out, We found that by listening to what people are already saying in social media about us, that we could learn a lot. There's this concept of temperament analysis, that is, are people saying good, bad, or neutral things about you? And most of what we found is that they're saying good things about us. And here's some examples from our Facebook page. So the first step in transformation was our chief marketing officer brought together key stakeholders within the hospital, developed a strategy, launched Facebook and Twitter accounts, just a few posts per week, mostly pointing to news items and press releases, and developed an employee policy. And the social media policy, several pages long, but some of the key elements is don't share patient information, only specified employees really speak for the hospital, and if you have a personal account, it's really your own opinion, not that of the hospital, and don't let social media distract you from your work. Patients always come first. Step 2 was to expand the YouTube channel, posted some of our existing videos as well as doing more with flip cam interviews with patients, physicians, and researchers, and focusing on wellness messages in both Facebook and Twitter, and initiate and expand our online chats and integrate messages with our traditional media outreach. And then really the third step, which occurred this year, is developing blogs and new programs, one called Move It, using social media and local sports to engage the community in more physical activity, and encouraging postings on our Facebook page and engaging patient communities. Specific to that, rare diseases are ideal for this because people are often disconnected from each other when they're involved in social media. But if they're not involved in social media and may not be aware of other people with the same disease. Some of our early missteps included not having a social media expert on board from the start. Sometimes we get, in the United States particularly, get overly competitive rather than focusing on our unique approach to social media. Delayed the use of social media at work, blocked YouTube and other streaming media, and lacked the education of employees about how to use social media in effective ways. A lot of other people are doing really good education in social media, and this from Webicina by Bercy Mesko is an example of a course specifically oriented toward physicians about social media and Web 2.0 technologies. And another opportunity is a short video called Digital Smarts, which really has to do with educating medical students and residents about digital professionalism, how to be professional in the use of social media if you're in medical practice. There are legal issues, and I've covered some of these before, and they also include possible regulatory issues, particularly around new drugs and devices, codes of professional responsibility, and potential conflicts of interest. But in conclusion, there really is an opportunity to use social media for great effect in healthcare, particularly in engaging patients with hospitals and providers, for patient communities and e-patients to interact with each other to really learn more about their illness, how to cope with their illness, how to talk to their doctors. Professional online communities where physicians, nurses, and even health IT professionals can talk to each other and learn more about current trends and communicate on an international basis very quickly. And then also the use of apps, mobile apps, and other tools to improve health. There have been misuses of social media but I think these can really be minimized through employee policies and education. We need to listen to what people are saying about us on social media and encourage employees to minimize the use of personal mobile devices in care settings so they don't interfere with care. In conclusion, feel free to contact me. Here's my Twitter account, blog, LinkedIn, and I will also post these slides on SlideShare. And then the Cleveland Clinic Twitter account, Facebook, and YouTube, which I'd encourage you to go visit. Thank you very much.
Ahora lo vamos a llamar por teléfono a las 3 de la mañana en hora de Cleveland.
Hello?
Hello, John.
Yes.
Nice to hear you. Thank you for waking up so early in the morning.
You're welcome.
We really appreciated your video, and it was a very nice presentation. I will ask now the public if they have any question for you, okay?
Okay.
¿Alguien tiene alguna pregunta? Yo la traduzco, no hace falta que la haga en inglés, no os cortéis. Se ha levantado temprano, venga, ¿alguna?
Por favor.
So we have one question. I will translate to you from Spanish.
Okay.
¿Qué tal? Buenos días. ¿Se oye? Sí, ¿no? Sí, a ver, yo la pregunta que quería sería un poco, digamos, la diferencia que hay entre Estados Unidos y aquí, ¿no? Es que aquí, digamos, la sanidad es, pues, evidentemente tiene carácter público, ¿no? Fundamentalmente yo entiendo que la diferencia, o digamos, las barreras que nos encontramos aquí, es más bien el médico considera que una red social le va a dar más trabajo.
So he's wondering that in here maybe it's different because we have a public healthcare system, but he feels that many MDs they are very concerned about getting to social networks because it will give us more work. And he's continuing.
Entonces, ¿cómo podemos convencer a los profesionales de que efectivamente esto no va a ser más trabajo, sino que va a ser, bueno, le va a traer en definitiva unas ventajas de mayor, al menos como yo lo veo, ¿no? Mayor calidad de atención al paciente, de, bueno, pues en definitiva un valor añadido que no tiene si no tenemos estas redes sociales, ¿no?
So he's asking if you have any advice on how to convince doctors and healthcare professionals that to get into social network it will increase the quality of care and not necessarily to give more work.
I think that's a very good question. I would say consider it another mode of communication between, initially between healthcare professionals. So the way I use it, although it's more healthcare information technology, is to communicate quickly with my colleagues and learn about current trends and publications. I know some and other health professionals have used it to talk in general about current cases, or confused to get advice. Yes, that's very confident. Identifying it can be you look more from your spouse, and it can be using a sparing amount of time. In other words, one must be online every minute of the day, but could spend a small amount of time this evening initially communicating with colleagues.
¿Alguna otra pregunta? We have one more question.
Hola, buenos días.
Okay.
Entre algunas de las dificultades que se señalaban en relación con el uso de los social media, aparecía uno que es especialmente sensible, que es el tema de los conflictos de interés. Bueno, no sé si en su experiencia nos podía ilustrar con algún ejemplo o alguna reflexión un poco más elaborada sobre el tema.
He's asking, you have mentioned conflict of interest as one of the main problems. Do you have any example that can illustrate that problem?
What I was thinking of there is, particularly if one had investments in a specific company, such as a physician having an investment in a drug or device company, and then promoting that drug or device through social media without explaining their conflict of interest. And this can be a problem sometimes with the very brief messages, such as in Twitter, where there really isn't space to give a disclaimer. But it's one of the cautions. In the United States, the bigger concern is with drug companies promoting their drugs through social media without all the required legal explanations, but it could equally occur with a physician or healthcare provider promoting a drug or device that they have a financial interest in without revealing that financial interest.
¿Alguna otra pregunta más y lo dejamos seguir durmiendo? ¿No hay más preguntas? So, John, I will make you the last question. That's from myself.
Okay.
With so much social media hype, like every week there is something new, trendy, how do you choose which social media to use?
That's also a good question. I think you need to choose what's right for you. In other words, choosing the right tool for the job. I don't think you necessarily need to keep up with the latest tool. There's a lot of discussion lately about the newest tool, which seems to be Pinterest. And some people really wonder about the value of it. But if you want to communicate with colleagues, you have to decide, is Twitter the best way to do that, which is a more open network, or do you find a private social network where you can communicate more confidentially with colleagues and you might feel more comfortable in that area? Or, as example I gave regarding Facebook, if you're a hospital and want to communicate or engage with your patients about general health topics, maybe Facebook would be the best way to interact. So it's choosing the right tool for the right kind of discussion that you want to have and not trying to stay up on the latest trends, which are, I think for most people, much almost overwhelming in terms of the number of possibilities. I would be very selective in the beginning about what's useful to you.
Okay. Okay, I think that was everything, so thank you very much. Now we'll...
Okay, have a good time.
Thank you, bye-bye.
You're welcome.
And now, ahora Larry Chu es el siguiente, el programa.